So no drills in your office.
The Solea laser is one of the greatest inventions in dentistry. Mark my word, in the future, more dentists will have them. But right now, there's only about 500 to 600 in the world, and we have one in our office in Idaho Falls.
Yeah, what does it do? I mean, what does it replace, I should ask? And what procedures?
It replaces getting numb and having a drill in your mouth. The two things my patients have told me my entire career, Doc, I would really like it if you would not get me numb and stick that whining drill in on my tooth. Okay. And now I can do that. The laser uses a very specific patented technology. The laser comes and it moves in a pattern and it can remove the tooth decay with no pain to the patient. It's amazing. It actually.
So you could prep what, like fillings or whatever, or what, for crowns?
So the laser works best for small, normal fillings that we do every day. Doesn't work well for crowns. It can be done, but it's very slow. You know, patients are going to have a crown done. They want to be done in a short amount of time. The laser just works great for just little cavities. Kids, there's a whole generation of kids that are going to grow up and they won't even know what it's like to get numb and have a drill in their mouth because I'm going to use the laser for all of their fillings.
Because, you know, a lot of kids, I've had dentists on the show that tell me that those early childhood experiences, now they don't want to go to the dentist as an adult. So I guess if you could take your own kids to a drill-free dentist using a laser, they're less likely to be afraid? Is that
yes.
Also what goes on?
My goal is to have a new generation of people that like going to the dentist. It's very ambitious.
You think that'll happen?
With the laser, I see the possibility. I truly see the possibility. I have patients that are driving and flying from other places, other states, to have the laser dentistry done in my office. It is remarkable, and it's fast. It does not take any more time. People say, does it cost more? It doesn't cost any more. Does the insurance reimburse for it? Of course they do. And the procedure is done quicker, easier, no numbing. Patients go back to work, their face isn't all sloppy, they can have lunch.
So no numbing, so you don't have to shoot the needle into the gums?
No needle,
okay.
No needle, from start to finish. Patient comes in, sit down.
Well, why doesn't every dentist do it this way?
I think just like patients, the dentists don't know. They're just learning about it.
Because it's expensive.
It's expensive. It's a $100,000 piece of equipment. So you make an investment, but if they knew how it changed the patient's outlook of going to the dentist, they would do it. That would be the next thing they would purchase for the office.
There's no noise like when they're prepping
There's a little bit of noise, but it's not a drill noise. The laser makes a little bit of noise. It sprays a little bit of water and has a little bit of airstream. This is what I tell patients. Most patients feel nothing. Some patients feel a little tingling, like cold water on your tooth. Something like that. If it's any more than that, let me know. I have lots of adjustments. I can turn the laser up, down. I can change it. It does the most amazing things.
And cost to the patient doesn't cost more than a regular, the old-fashioned way.
Doesn't cost any
more.
With
the drill.
No. This is what I thought. This was the paradigm shift for me. I thought, what is it like for the patient? The patient's experience is much longer than the dentist's experience. This is why dentists aren't doing it. The patient comes in, they get numb, they get the filling done, right? Maybe they're done in 30 minutes, right?
Okay.
How long does the numbing last for you? 2 to 3 hours, typical, right? So that means the whole procedure is 3 hours long. The dentist, he's on to the next thing. He thought it was only 30 minutes. I'm thinking of the patient. I want the patient's experience to be better. I made the investment because I want the patient's experience to be that much better. To take it from 3 hours to 30 minutes.
Because nobody wants to be numbed up.
No one wants to be numb. So it's like
as far as
my
with the
whole
needle.
day. I had to take the whole day off because I'm going to be numb. I can't do my meeting. Can't do my presentation. My whole day is shot because of this one filling. Now it's not. My patients, I have a lot of patients that are engineers. They have presentations to do. They came over their lunch hour. Come in, get the filling done, go back to work. No one even knows.
If I would have known you had that laser, I would have told you to bring it today. You could have helped a few of us out here, right?
Yeah, I would love to do it.
Good topic. So if somebody needs a cavity, they need to find a dentist with one of these lasers.
The Solea
probably
laser.
Less than 1% of dentists have it, though. That's the problem.
There's other lasers that have been out there for several years. They work on different types of technology, older technologies. They do some of the things this laser can do. This is the FDA approved only laser to cut tooth enamel and to do fillings.